Hi everyone, welcome to Nick and Nat's Nature Chat. Sorry it took us a while to get our first major video out looking at science. Today we're going to be talking about how scorpion venom could potentially save your life if you have brain cancer. I'm really excited about this topic because right now I moved on from doing my PhD work in breast cancer to working for a neurosurgeon now. So I work on studying brain cancer now and actually get to more of a clinical setting. So I'm really excited about this topic. Obviously any cancer is horrible, but brain cancer is very bad because it has a very bad outcome for a lot of patients. Research hasn't gone very far with brain cancer because it's such in a specific spot where it's very sensitive. Your nervous system and your brain is very sensitive. It unfortunately has horrible outcomes, and the longevity after diagnosis is not very long. The average length of survival is about 12 months, a little over a year after surgery or chemotherapy or anything like that. The goal of research is to improve patient outcomes and increase the life expectancy with the overarching goal of eradicating the disease. Scientists have discovered a component of venom that has been used in treatment of brain cancers. Specifically, this venom was from a Deathstalker. Our stand-in is going to be Freddie, my desert hairy scorpion, because I don't have a Deathstalker yet. Maybe Santa will bring me one for Christmas. Deathstalkers are found primarily in northern Africa, parts of the Middle East and Asia. There are documented cases of deaths from Deathstalkers. However, it's usually in children or elderly people where they usually have some kind of underlying problem. However, there are components of Deathstalker venom that do affect the nervous system. So if you ever hear people with venomous snakes talk about neurotoxins, that is a component of Deathstalker venom. It is supposed to be in small volumes to kill small prey items because they're not very big, but anyone with underlying conditions or more vulnerable populations like children and elderly adults can have respiratory failure and cardiac arrest from Deathstalker venom. So not all components of Deathstalker scorpion venom are neurotoxins. Neurotoxins do affect different ion channel pathways. So like for example, potassium ions that can be affected by neurotoxins. However, in one drop of Deathstalker venom, we can have a million things that make it up. And scientists were able to break down every single component of Deathstalker scorpion venom, and they were able to pull out one single little component called chlorotoxin, and that affects chloride channels. Luckily, Binks loves chlorotoxin. It's not actually chlorotoxin, it's a yogurt treat. So why is chlorotoxin important and why is chloride ion channels important? Well, in glioblastoma, or gliomas in general, brain cancer, when cells migrate, they migrate from one part of the brain to the next. So it can just literally be from here to over here. But in order to do that, they have to be able to move through small little pores. And to do that, they need to change shape or somehow change the cell. So for example, if we have a brain cancer cell and it needs to go through a small little hole like this toilet paper roll, it can't move. Well, in glioma or glioblastomas, brain cancer cells, they're able to take chloride and excrete it out into the surrounding space. So for example, we have a balloon filled with air. The room is filled with air. We're able to let out some of the air. Then the cell can go through, and then we can put air back into the cell, and then it moves to a different part of the brain. So the mechanism of how brain cancer cells migrate using chloride is very important for the fact that chlorotoxin is able to stop those chloride ion channels. The idea in research was if chlorotoxin can stop the release of chloride from glioblastoma cells or gliomas, can it stop them from migrating and making the disease spread? So when we do research, a lot of times we just kind of have an idea, like this hypothesis of, oh, if we use chlorotoxin, we can stop cells from migrating using the prevention of chloride secretion out of the cells. So instead of everybody getting scorpion lobotomies, they then synthesized their own chlorotoxin, and that way it eliminated any other components of the Deathstalker venom. So they were able to throw their own version of chlorotoxin at some brain cancer cells, and when they did this, they noticed something really interesting. They noticed that it bound entirely to brain cancer cells and did not bind to healthy brain tissue, which is really interesting in itself, and we wanted to know why. So they found out that chlorotoxin bound to a matrix protein called MMP2, and this is involved in tumor cell invasion. So this is starting to come full circle as we're wanting to be able to stop the invasion or movement of cells into a different part of the brain. This was an important finding because MMP2 is elevated in brain cancer, and that is why it binds exclusively to brain cancer cells and not to healthy brain tissue. So we wanted to be able to use chlorotoxin to our advantage. So scientists hypothesized that they were able to put something onto chlorotoxin and then have it bind to cells. Would they be able to tell when doing surgeries that there is healthy tissue versus cancerous tissue? So what scientists can actually do, and Nick has done this in the past, is where you can take something in like something fluorescent or bright glowing light, you can tag it onto your interest thing, and then because it was chlorotoxin and we know it binds to the brain cancer cells, they will then put it into the tumor tissue that then will bind here and then will allow the tumor tissue to glow while the brain tissue stays dull. This concept right here was the first development of what they called tumor paint. So they're able to paint the tumor using chlorotoxin with a tag that was fluorescently labeled on it. So that way when it bound to only the glioma or brain cancer cells, you could tell exactly where the healthy tissue of the brain versus the brain cancer cells were. So as working for a neurosurgeon, I've been in the OR and I have actually seen this mechanism in action, and it's actually very helpful, especially when it comes to more microscopic levels of surgical removal of these tumors. Researchers were able to also use chlorotoxin on glioma cells, and in doing this they saw that there was a reduction in movement of these cells. So they were hoping that if it made it to clinical trials, that it would reduce the spread of the cancer cells in the brain. So luckily for these researchers, it actually eventually went to clinical trials. This clinical trial was very recent. So the paper that published this clinical trial was in August of 2025, so a few months ago, which means that the patients that were recruited for this trial were probably the past few years. There was a total of 4 patients, and all of them received surgical resection and then treatment of chlorotoxin. And they were hoping that this would slow down or prevent the recurrence after surgical resection after they removed all of the cancer cells. Out of all 4 of these patients, none of them had any incredibly huge adverse events besides high blood pressure, but nothing too concerning. So interestingly, they used chlorotoxin in combination with a immune response therapy, so that way they could trigger the immune system to combat the brain cancer cells as well. Unfortunately, all 4 of these patients passed away, but they did have a better outcome. So these researchers did see improved infiltration of the immune response for these brain cancer patients. One caveat to this clinical trial though is that there were no placebos. There wasn't a control. There's nobody not getting the chlorotoxin or the immune therapy, so we can't contribute it just to the chlorotoxin. But again, this is in very early development and the first time it's made it to clinical trials, so we can't rule it out completely. While this clinical trial wasn't a grand slam, we're still able to learn a lot about the mechanisms of glioblastoma and the use of chlorotoxin in surgeries or in the treatment of glioblastoma. As a doctor, PhD, not MD, but still, as a doctor working for a neurosurgeon, I don't recommend you go to your local expo and look for the cups that have skull and crossbones on it and buy yourself a Deathstalker. Do not give yourself a Deathstalker lobotomy, please. This will not help you. Like I said earlier, there are lots of components of scorpion venom, not just chlorotoxin, and they were able to synthesize chlorotoxin outside of the scorpion venom, so please don't do that. I hope you guys learned something good today and we broke it down really well for you. Thanks for tuning in. Remember, this is Binks, and I don't think you've met our dog Liam yet. This is Liam. Hi, do you want to say hi? Can you talk? Talk? This is Nick and Nat's Nature Chat. I hope you enjoyed, and we hope to see you in the next one.